Good to have you back on the news. The Nigeria Center for Disease Control has confirmed 4 new cases of Lassa fever in Edo, Ebonyi and Taraba states. The agency's Lassa fever situation report revealed that there have been 128 deaths in confirmed cases since the outbreak started this year, and 7,368 contacts have been identified from 20 states. Meanwhile, the Kebbi state government has confirmed 1 death from 6 cases of the disease in the state. Well, for more on this, I have with me in the studio a medical doctor, Tuyi Mebawondu. Good to have you.
Thank you.
Here we are again. We're still talking about Lassa fever. It's still taking a lot of people out, to put it mildly. 128 this year already, and we're in May. What does that really mean for Nigeria?
Simply put, it means that 1, we're having an endemic situation that then we experience spikes occasionally, and 2, we've not been able to respond appropriately to this outbreak of Lassa fever. We know when it is going to come up. Since January this year, we've been on it. We've lost close to 22% of the people that were affected. That's the 128 people. That's very high case fatality. It means we've not been able to raise response appropriately to beat back this Lassa fever, this thing. And of course, the response is not just health alone. It's about environment, it's about agricultural practice, it's about community involvement, it's about even our habits in terms of how we store and handle food. It's about our personal hygiene, because if you look at those figures, you see that quite a number of health personnel are also involved. And you saw the story, going around about the state of the health, even in the government hospitals and what we're seeing. So again, it's a reflection of the negligence, of which we've seen all over the years.
So we've talked about Lassa fever and meningitis and other outbreaks several times on this show, on the news and other programs on TVC, and we continue to say the same thing. What exactly is the appropriate response that will tackle this in a sustainable way?
Political will. Okay, because we're just paying lip service to health. It's great that, for instance, you highlight the issue on the news, you bring the consciousness of people to it, but we need a political will to say, okay, here and no further. 1, because you need to mobilize human resources. 2, you need to mobilize funds. 3, you need to seek your partner. 4, you need to look at the totality of this things because this recurrent epidemic is a security issue, unless we try to see it from that perspective. It's a serious security issue that can have deleterious effect on the country, the population, and even whatever we're doing. Because, okay, look.
How much work is the Center for Disease Control doing
to
push back these outbreaks every now and again?
First and foremost, how much money do they have to do the work they're doing? Secondly, how many human resources have been deployed to help them fight the work? Well, the CITREP, Situation Report, can always tell you this is where we are, this is what we're doing. They have to really engage in terms of public discourse, the epidemiologists. They have to actually, be on top, try to figure out. But even the figure they're giving us, I know, from experience, that this is like an iceberg phenomenon. You see the tiny part, the huge part of the figure is hidden, and we cannot really get it.
What role would public enlightenment, both at the rural level and, of course, in the cities, how much impact would this really have?
It's going to have impact. Because
are you even saying that at all?
We're not until we hear on radio, because that is the cheapest thing we can deploy now to beat back some of these epidemics that is, straddling the public space in Nigeria, day in, day out, month in, month out, year in, year out. If we're not fighting meningitis, we're fighting Lassa fever. We're not fighting Lassa fever, we're fighting all sorts of cholera. So we need to actually go so local. We need to go to the root to develop information materials that people can understand and know that this is the activities we're doing and that is messing up our health system. And of course, you see that even in Congo, you see that now the health workers are even targets now. The people attack health workers, they bomb the hospital, they kill them. It will get to a point, whereby as security situation is breaking down in the country, we'll see more of this thing coming up. So it's a serious issue.
We'll have to leave it there. Dr. Tuyi Mebawondu talking about fresh outbreak of Lassa fever. The CDC, Center for Disease Control, has confirmed 4 new cases of Lassa. Thank you so much for joining us.
Thank you.